my time, let us move on. Wishing you all a very, very warm welcome. I'm already been introduced. Just me. Basic question everywhere we get is after PUC or plus 2, what next? Every family with children in this age group have a very big question, what is to be done? Yes, sir. Are you able to hear me, sir? Oh, ಅಲ್ಲಿಂದ ಬೈಕ್ ಹೋಗ್ತಿದ್ಯಾ ಹೋಗುತ್ತಾ? So are you able to hear me, sir? No?
Yes, sir.
Are you able to hear me, sir?
Yes, yes, sir. Yes, sir. Continue, sir.
Hello?
Yes, please continue, sir.
Okay. So every family having children in that age group, 17, 18, or just completed PUC or plus 2, very basic question, what should my son or daughter do after PUC? So my topic I'm supposed to discuss with you, rather I would say interact with you, is higher education and career options in medical sciences. Being a medical person and to some extent having the knowledge of biology, because before my MBBS I did my BSc also, how I can give some information and ideas which field they can take up and what are their opportunities. The basic thing I always tell everybody whom I met when they ask this question, what next? It is not necessary that everyone has to become doctors, engineers, scientists, and so on. There are so many other opportunities. But being a doctor for nearly 43 years, I completed my MBBS in 1980. 43 years getting over now. There are so many negative things. I'm not saying the doctors are bad or anything, profession is bad, but there are a lot of things which the parents and the students or the aspirants have to understand. It's a lifelong work and learning. Unlike other professions where you can go to office 10 to 5 or 9 to 5, whatever, it's not so. It's around the clock work. Unlike other professions where you can learn, have a specific fixed information, work on that, is a lifelong learning. New diseases come, new investigations, new treatments. Till we are in the profession, I always say, till our death, we have to go on learning. Professional life becomes more important than personal life. In fact, some of my friends used to say, never marry a doctor. He or she will be more into profession as the first choice, family or the personal as the second choice. That is a fact because we are more bound for care to the needy. Remuneration, there are many professions where you can earn much more. It's not remunerative at all. If you are bothered about making some money or remuneration, it's not a profession. Because of the different types of diseases that we see, we always have some stress, different grades of stress. Even the doctors have a lot of stress and problems. And because we are dealing with emergencies of varieties, maybe accidents, it may be heart attacks, is always a risk to the patient and risk to us also sometimes, which you see in the papers and news. And we have to work 24 hours, no timings. Middle of the night, I get a phone call, just get up, dress up, and rush to the hospital. So these are the negative things which may not be there in other professions, right? You have a office work, after the office work, forget about it, only next day morning is your office. But it's not so in our profession. This has to be very seriously understood by the candidate as well as the parents before taking up the medical or related. I'm not telling only doctors, even the other fields which are related to medical profession, like paramedical courses. There's so many other courses that are more fascinating, and one can lead a happy and successful life in all aspects, not only money, every aspect. So, keeping this basic introduction in mind, we'll try to analyze the different fields and finally decide, is it worth taking up a medical or paramedical professions. Usually, whenever the student comes, I always ask the student to bring the parents, because parents, their ideas, their intentions will be different from the students. So I would like to discuss with both the parents and the students. Many times it's because of the parent that the student has to take up a course. Rather, is the other way is better. Identify the potential in your child, boy or girl, which field he or she is interested. Then they will enjoy the profession. They will come up in life. They will be successful. They will be happy. They will also say, "Thank you so much for allowing me to take up my choice," rather than forcing him to become a particular profession, maybe doctor, engineer, whatever, which he or she may not really like it. So which field he or she has interest and passion, put them into that. They will really pass on very happily. They will be successful. They will pass out with good marks and even the profession they enjoy, and they will always be grateful to you. Do not force them to take up the course which you are interested. I am so and so, I have money, or my family is so and so. I want my son, my daughter to be a doctor or an engineer or something. Many times I have seen in my teaching line of 40 plus years, the student is not at all interested, but the parents want his son or daughter to take up the medical profession because it's a question of prestige of the family. My brother's daughter is a doctor, my relative's doctor engineer, and so. My daughter, my son has to take it up. So many times it becomes a little problematic to the child, and they fail many times. They get depressed. They are not interested. In many cases, we have seen them leaving in the middle of the course. Waste of time, waste of money, and so many things. So rather, you discuss with them whether they are really interested in the profession. You give them introduction about each profession, find out whether they are interested. They can have first choice, second choice, third choice, and all that. We may not be able to get what we want also, but there is always a second choice. So this aspect I really stress because they are going to be really happy taking up a particular profession, particular course, and their future. Right. So a few things before I start off with the details of some of the courses are important for the candidate. Maybe parents also should be able to understand this. A positive attitude for happiness and success in your life, very important. Self-confidence, saying that I can do it. I want to take up this profession, this course. I want to really study very hard or smart, and I will pass out and take up the profession. That aspect of self-confidence is extremely important. All professions are noble only, not only medical related. Every profession is noble. There's nothing like a good profession or a bad profession. It's only a question of my like. Somebody asked me, if you were not a doctor, what you would have been? I said, anything else is fine. I have some hobbies of engineering. Maybe I would have been an equally good engineer. Maybe I've got a hobby of cooking. I can take up a hotel administration. Why not? Actors are happy, artists are happy, musicians are happy. There's nothing like only medical profession is great. All professions are great. Only nobility about medical profession is we deal with suffering, we care for them. So that may be one plus point compared to the profession. Otherwise, nothing great about medical profession. So because we take care of the suffering who are dying or really having a problem, with our knowledge and skill, we try to manage and make them better. That's the only thing about nobility, noble profession. Otherwise, things are fine. I'm not talking only doctors, all the people involved in the hospital taking care. Somebody has to come to you with a hope of getting help. Has come to you, yes, in our medical profession. It may be doctors or the nurses, technologists, administration. It's our duty to put in our best effort to relieve them of their suffering, pain, or anything. So there's only nobility about this. whereas other professional people may not be able to manage this particular situation. So we doctors are given a little, maybe one step more respect or more responsibility compared to other professions. Otherwise, every profession is good, great. So most important thing is there are two things in our life. One is the healthy mind and there is healthy body. Both are mutually interrelated. If you want to be healthy physically, your mind has to be healthy. Many times we see a little confusion and a problematic in either of them. So this is very much necessary. Discuss with your child. Explain this is the situation. Are you happy? Are you satisfied? Do you have any questions? Talk to people who are in the profession and make them very clear in their mind. Let them not enter a profession, join a course with half-minded or doubtful. This thing. Let them be clear. A few alphabets. I'll just go through a little faster because we spent quite a bit of time in our problem of the internet. So, as the kids start with their alphabets, A for apple, B for bat, and all that, a few words here and there will explain. Otherwise, changes to be made from a PUC student to a professional student. That's very important. They have to change their attitude. You're not a bacha, a high school or a PUC flow. You're a professional, going to be a professional. Change your attitude, change your lifestyle, change your way of looking. Be active, be attentive. Serious profession, right? You have to be bold. A lot of different types of diseases, emergencies, accidents come. You have to be bold to manage them. Belief is the most important thing according to me. You have to believe your patient and relatives. They have to believe you also, right? Belief has got a very high role in the final management. Commitment. Whatever we do, we are committed. I'm doing this. Yes, I'm doing it. Explain to the patient or family members. This is the way we work, right? Dedication, of course, is necessary. There's absolutely no compromise for efficiency. Whatever you do, do it with enthusiasm, wholeheartedly, things will work out. Be friendly with everybody. Let people think that you, as a doctor or a nursing staff or a paramedical person, is really concerned and you're approachable and you're going to do good to them. That mutual relationship is very much important. And whatever way we can express our gratitude. Patients always have a lot of respect. This is my personal experience. They think that we are God, even though we are not gods or anything at all, because we have got a specific knowledge and skill to understand their problem, diagnose their disease, and manage. They always have a gratitude. They come with folded hands saying that please do something, sir. At the shortest period of time, our suffering has to come down. We have to go back to our work. So, in the same way, you also have to have gratitude to the patients and relatives. They come with a belief in you. You also show them respect. Yes, I can understand your problem. I'll do my best. Definitely, will be better at the shortest period of time. That mutual belief and gratitude is extremely important. Hard work, yes, very much necessary here and there. Honesty, yes, there's absolutely no second word about the honesty. You have to be honest to the patient or the relatives. Explain, no question of telling lies. This is the problem. This is exactly the problem you have. Let me be very clear. In a very decent language, very clear, simple language, explain the situation. Even if it's cancer, we tell them this is cancer. Let's understand what best can be done, we try to do it. Then people will believe you. Saying that nothing, you're going to be, everything is fine, you're going to be 100% all right. Those things will not build up a good relationship. Happiness. Tell them, be happy. I'm there. I'll take care of you. Yes. So the positive attitude always makes the patient and relatives happy. Yes, sir. After talking to you, I got confidence. I was really depressed. I was really unhappy whether I'm going to have my disease cured or I'll be all right at all. I'm going to die. All those negative things will be there. The way you talk to them, the way you smile at them, saying that everything will be fine. Why do you worry? Be happy. Yes, it puts them into sort of a positive track. Intelligence, of course, memory, intelligence, all are very important. Be kind to them. They are suffering. Let's not shout at them. They may have some problem. They may talk a little harsh. You don't understand. Okay, okay. Be cool. Don't get upset. Yes. The way you talk to them lively shows them that you are knowledgeable, you have got a good knowledge and skill memory. With that, I'm going to become all right. That impression they have to get. Good mannerism, morning, say good morning to the patient and relatives. How are you? I see in your face you are much better compared to yesterday. Once you say that, they really, sir, oh, very nice. Now that you have told, we believe. So that type of a positive words, very important. Observation is the most important for any profession, most important for any profession. Observation of the patient, observation of the changes that have occurred. Is it becoming better compared to yesterday? Or is there any change which you have to take care of? Observation is most important, any field rather. Be passionate. Tell them, don't worry, everything will be all right. We are upset. Hundreds of patients with the same problem come. They all become all right. So put in a lot of positivity in them. They will believe you. Yes. Ask them questions. Allow them to ask questions. Let their mind be clear. Right? So take the responsibility. Show them respect. Maintain the time. Very, very important. A few seconds and a few minutes can count between life and death. So unlike casual professions where you can reach the job or the profession half an hour, 1 hour later, hours really matters. Time, every second, minute counts. And timely treatment, timely management is going to decrease the suffering. And even many times I have my own experience. It can save a life. A person who is dying due to so many things, maybe a heart attack, maybe a dehydration, maybe vomiting, loose motion, maybe whatever cause accidents, bleeding. A timely approach, timely treatment management, we have seen. Many times I feel so happy. I've saved a person. That's the final responsibility of mine. Sincerity. You have to have strength. You have to be mentally and physically strong to take care. People may be crying, maybe shouting in case of a accident place, but we are there. Yes, don't worry, I'm there. I will take care. So I understand the patient problem. And most of the time, most of the doctors, efficient doctors, are workaholics. Their profession is most important. So these changes in their response, in their physical, mental aspects are extremely important to take up a medical profession. This is important. You cannot be casual. You cannot be light, taking lightly and all that. So if you are ready for all these changes from your PUC student to a professional student, it may be doctor, nursing staff, technicians, or whatever other things, you take up the profession. If you feel I'm not able to take up any of these things, say thank you and go to some other profession which may be casual. So all these are very much necessary to be in a medical profession because I told you, people have a suffering, people are serious, people are expecting your uh, perfect treatment to become better. So this is extremely important. So now let's quickly look into the different courses. What is the scope of each one of them? Medical, yes, MBBS. Bachelor of Medicine, Bachelor of Surgery, yes. So 5.5 years course, 4.5 years study, 1 year of training, internship. With that, what are you going to become? Happily, you can open up a medical, this family practice, a clinic, or a practitioner. Yes, you're going to see a lot of patients every day, morning to night, and people are very happy to have their own family doctor. Varieties of most of them, 90% of them are not serious ones. You can manage them. A very good experience. People have a very good opinion about you. Whole families come to you. I've been practicing since 39 years. Thousands and thousands of people I've seen. They are happy with me. I'm happy with them. So there's a basic thing. You do not want to do anything more than MBBS. Fine, absolutely no problem. You can have a very happy, very peaceful life. You can join as a government service as a medical officer, assistant surgeon, and all that. Still, you can have a good salary, work in the government services if you like government. That's always there. You can work in a medical college or a dental college, or so many colleges are there where you can teach. If you have got a passion for teaching, in addition to a medical doctor, you can also be a teacher, lecturer. You can take up administration. There is also a good, interesting field. You can take up research in any institution. Research and scientific work is always there. Further, you want to do some specialization. You want to become a specialist in some fields, maybe medical field, surgical field, super specialist. There's always a opportunity. There are entrance examinations. There are MD, MS, DNB examinations. You can always do it. There's no end to it. There's no end to learning at all. So medical profession has its own advantages. But my own point again, I repeat, is at least 10 years, 10 years to settle down as a specialist. 5.5 years for MBBS, another 3 years for MD, MS, or DNB. In between, you may be preparing for the entrance or anything else. Approximately 10 years. So be careful. Whereas a engineering student in 4 years, 8 semesters, he always goes for a job, gets a good job, maybe goes abroad, gets 50,000, 1 lakh salary. All those things are always there. But ours is a different type of a profession. Money may not be the primary intention, but we have our own roles and responsibility, maybe respect too. So this one has to keep in mind. With just MBBS, sometimes it may be difficult. You would like to do master degree in the medical field or surgical field. So there's always a possibility. There are lots of seats in the government medical colleges, both for MBBS and MDMS. Little smart work, honest, sincere work, definitely will get. All my education, starting from primary school till my MS or PhD, I did in government colleges without paying any donation, without spending much money. I used to get a lot of scholarships and freeship. You can do it, but it's a challenge. You have to really work hard to get good marks. With minimum amount of expenditure, you can get anything. But if you're not very good in your studies, maybe you have to shell out a lot of money as a donation. There is always there, right? What about the dental bachelor's degree in dental surgery, dental sciences? It's again a 5 year course, 4 plus 1 year. You can become a dental surgeon, open up a dental clinic. Again, you can work as a lecturer in a dental college. You can work as a researcher, scientist. You can do MDS. Yes, again, a master degree. Different subdivisions are there. You can earn a lot of money. You'll be busy. And even PhD, you can do auto MDS. A lot of my colleagues have done PhD also. So you'll be taking care of the dent. It's not a question of just pulling the tooth or putting a artificial denture. There's so much surgeries, cancers of the gums and teeth, a lot of research work, a lot of it is there, a lot of demand is also there, right? It's not for sake of a degree, uh, a girl getting married, no, it's not that. You have to take up the profession, you can really enjoy your profession and do good things to others also. There's a lot of demand for the qualified dental surgeons. Yes, the biggest thing that I would suggest for a not so serious, I would say not so very intelligent fellow, there's a lot of scope for BSc, Bachelor of Science. It's a 3 year course after PUC. There are a lot of technician courses after SLC. There's a different. This is a graduate course. A good degree, good salary, good opportunity. There are so many courses, more than 2 dozen or 3 dozen courses, both in government as well as private institutions. Not very expensive, but you have to understand what each course means before you take it up. Nursing staff, yes, you take a BSc in nursing, can work in a private hospital, you can work in a private clinic with a consultant, you can join a nursing college, you can teach. Yes, a lot of scope is there. So much of scope even abroad. 5 star hospitals abroad, there's so much of a need. Lot of demand is there, lot of need is there. Wonderful profession is equally good as the doctor's profession. Only in India, the nurses work as an assistant to the doctors. Whatever the doctors advise them, they give the treatment. Whereas when you go abroad, outside India, most of the countries, nurses are 99% equivalent to doctors. They diagnose, they give treatment over phone or otherwise, they consult the specialist. This is I'm doing. Is it okay? Anything else you would like to suggest? So they are almost equivalent to doctors. Their knowledge is also almost 99% equivalent to doctors. So there is a very high scope. They got a lot of respect, very high salary also you get. So nursing profession is a very great profession. They know the things of all the diagnosis and treatment, a very great course. Some amount of commitment is necessary. Again, like the medical profession, you work 24 hours a day, night duties, day duties, emergencies, everything is there. Yes. Another is BPT. BPT is bachelor's degree in physiotherapy. Yes, nowadays picking up a lot of demand, lot of neuromuscular problems, joint problems, lot of freelance physiotherapists are there. They can have their own clinic. They visit different hospitals. They are earning a lot of money. They can work in the physiotherapy colleges. They can work as a part-time teachers to other institutions. So a lot of demand is there because people have a lot of problems nowadays. Diabetes, obesity, overweight, a lot of problems are there in different age groups. So there's a lot of demand for physiotherapists. Again, a very great course, good salary, not very expensive to study also. Similarly, newly has come up with the occupational therapist. BOT, what we call bachelor degree in occupational therapy. Many occupations, lot of demand. Now it's picking up in India. Abroad, there's a scope, a lot of scope for occupation, different types of occupations, what their health needs, what are the different problems they have, how do the occupation therapists help in preventing further complications, prevention of the problems, lot of scope is there, right? And all these courses, this is nursing or physiotherapy, occupation, they are all master degree courses. MSc nursing, MS, MPT, MOT, all this. They can even pursue PhD. They can work as a professor. They can become head of the departments. They can become principals. Many of my students have become principals in many of the colleges. I'm so proud of them. So there's so much of a scope. Further continued with BSc. BSc nursing is there, physiotherapy I told. Lab technology. Earlier, we used to have a lab where the technician, a small boy or a girl, used to work as a lab technician. This is different from this lab technician because this is a degree course, 3-year degree course after PUC. Those who have done DMLT, what we used to call diploma in lab technology, medical lab technology, they can join as a lateral entry. They can get a BSc degree. 1 year exemption is always there. So nowadays, lot of investigations are done, blood tests, urine tests, motion tests, cerebrospinal fluid, lot of biopsies, so many, lot of dependence on the labs are also there. They can open up a lab of their own. They can always have consultants giving opinions. So very high demand is there. Most of the five-star hospitals nowadays, big hospital, need a, they're not called technicians, they're called technologists. Under them, 3 to 4 technicians will be working, only they need to guide. So a lot of demand is there for this BSc MLT. Similarly, imaging technology. Imaging is X-rays, ultrasound scannings, different types of scopies, CT scans, MRI scans, PET scans, so much instrumentation has come now. So all the management of all these things, technology, so much of demand. They get very high salary, very difficult to get a MIT candidate. Then in the operation theater also, there's so much of a work. The surgeons and the assistant surgeons, everybody need an assistant. So BSc occupation theater technology course is there. They are taught everything about what are the different types of hospital, what are the different types of instruments available in the operation theater, what is the way the patients are treated, different types of operations, what instrument is there. Anything can go wrong in the instrument, immediately they should be able to rectify. Everything is taught. It's a very, very great course, very interesting course. A lot of interesting is there. Perfusion technology, again, the cardiac surgery and other serious, very, very great surgeries need a perfusionist. Again, a BSc fellow, qualified fellow, will be almost equivalent to a surgeon or anesthetist managing the patient in the operation theaters. Dialysis, yes, all of us are very familiar with dialysis. Dialysis deals with the people who have a kidney failure. So a lot of hospitals, including government, private, have dialysis machines for the people they manage themselves. A smart and dialysis technologist or technician, they can manage without even the doctor. They can consult the doctor whenever there is a need. So a lot of demand for dialysis technology specialists. Respiratory care, yes, a lot of respiratory diseases there, particularly in COVID and Corona. You have seen hundreds of thousands of people admitted to the hospital. They have to be taken care of, emergencies and all that. So we teach them about everything about the human biology, respiratory system, all the common diseases. They take care of this. There are ventilators. They take care of the ventilators, everything. Very high demand for them. Cardiac care technology, cardiac surgeon technology, the operation theater and outside operation theaters, ICUs, CCUs. A lot of demand is there. Very high salaries are available, and they really take up the serious patients. Similarly, we have other courses like microbiology, a lot of demand, a lot of nowadays, a lot of bacteria, viruses, we have seen in the papers, microbiology laboratories. One can start up a microbiology laboratory, have a qualified doctor also helping them out in diagnosis and further help for the patient. They can work in the hospital laboratories or they can have their own laboratories. A lot of research organizations are there. Without hospital also, a lot of research organizations are there where the microbiology technologists, microbiologists, medical people, non-medical people, so many people are working. A lot of diseases related to microbes or audiology. Yes, we have a speech and hearing department which deals with the problems of speech and hearing. Audiology is another subdivision of that. Technicians can take it up. Even BSc speech and hearing is also there, 4-year course. Very high demand. There are only few institutions in India, maybe half a dozen or so, who can take up a BSc speech and hearing, MSc is there, PhD is there. Or they don't want to go so high, they can take up audiology, audiometry, lot of hearing problems. They can have their own private setup, or they can always join a speech hearing institute or even a medical college. Veterinary science, very old institution, lot of demand nowadays. We have a lot of animals, pet animals as well as the domestic animals. In fact, my father was a veterinary doctor. He was interested in me taking up the veterinary science. Somehow I didn't have much of a interest in all these animals. I said that Danagal Dr. Balu, General Doctor, if there's opportunity. So I took up there. Luckily, he got the medical field. I stood the second rank to my university in BSc, so I got it. So a lot of demand because villages, they've got so much of animals to take care and they respect them like gods. So a veterinary doctor has very high respect. They can have a freelance practice. They can join the hospitals. They can have their own private hospitals. A lot of demand. A lot of pets nowadays we see, right? Similarly, agricultural sciences, very high demand. Agricultural BScs, MScs, PhDs, marine biology, fisheries, everything, every field is having a very, very high scope nowadays. It's only question now whether you like it. I repeat, if I like fisheries, I like fish, nothing, even if they give me free seat for a medical MBBS, I can say no, I don't want. I want fisheries. So the passion of the candidate, not the family members, certainly not the parents, and never compare your son, your daughter with somebody else, relative, neighbor, opposite house. Opposite of girl got to MBBS, I want my son also to do MBBS. He may not like to see a patient, he doesn't like people crying, suffering, and definitely he doesn't like blood also. Putting them is a headache for you, and sometimes a headache for us also. He doesn't like to study, he doesn't come to class, he fails. When we counsel them, when we talk to them, he openly says, "Sir, I was not interested in medical field. I feel very bad to see patients suffering. I don't like blood and all that." Then why did you not talk to your parents? He said, I talked to them, that they were very particular that I must become a doctor. So these are all catastrophic. So talk to them, give them all the information like this, every field. Definitely can make out which areas they find interesting and have 3, 4 choices. Then they will really enjoy, they will study very well, they come up in life rather than putting into a position or a course which they don't really like, right? Naturopathy and Yogic Sciences, very few colleges. In fact, I also teach there part-time. Very nice course. They very few colleges in Karnataka, I think only half a dozen or less than that. Only one government college also that's in Mysore. I teach them. Wonderful way of approach, sometimes which is not cured by allopathy, not cured by Ayurveda. They get cured, yes. Every field has its own advantages also. Lot of these things, scope in biomedical engineering. Incidentally, I have a lot of hobbies of engineering. It may be surprising for you, a medical person having engineering hobbies, due respects to engineers. My hobbies include electronics, electrical, carpentry, whatnot. So in free time, I do all these things. I design small instruments. I discuss with engineers. In fact, I go to engineering college also to teach anatomy and medical science. I learn from them. So, upcoming field, lot of instruments. We do not understand the instruments. We doctors do not know what the instrument is. We are afraid to press a button. So, a lot of biomedical engineers. You can have a freelance. You can join a medical college. You can have your own factory to design and maintain, repair. A lot of instruments are there. Many of them are close together. So there's so much of a demand for biomedical engineering. A lot of BE, ME, MTech students are there. I talk to them. Very wonderful course. If you have a passion for both medicine and engineering, like me, is a wonderful thing. I try to even read some of the engineering books, medical engineering books, to understand the principle by which it is understood. There's a need for knowing both the subjects. Nutrition and dietetics. Nowadays, a lot of people having problems related to nutrition, obesity, overweight, nutrition deficiency diseases. No idea about what is to be eaten, what is not to be eaten. So a lot of BSc, MSc courses. A lot of my friends have done PhD in this. So there is a scope and a job available in the hospitals. Nutritionist, dietitian, very good salaries. Abroad, so much of a scope. Genetics is another quite a old field, but getting a lot of importance nowadays. A lot of diseases have got a genetic basis. Big laboratories are there, genetic genomics, genetic basis, different types of investigations. So a lot of birth defects are there. Genetics is a big field. Even the universities teach genetics, medical genetics, and other genetics. One is interested in this area, lot of scope for research, lot of scope for PhD. And believe me, the government departments like Department of Science and Technology, DST, Department of Biotechnology, they have a lot of money. They spend a lot of money on these basic sciences, including genetics. We get a lot of funds for doing research work, projects, and I also get involved in all this genetics work. We get good amount of money and encouragement. And you can go abroad, do a lot of work in the genetics or genomics. Biotechnology is another field which is going in a very high way. A lot of research, a lot of technology getting transferred to different fields for human welfare. Yes. So pharmacy is another field. Again, a very great scope. B Pharma, M Pharma, PharmD, 5 years course, PhDs. A lot of pharmaceutical industries need qualified, efficient pharmacy person. Psychology, clinical psychology, psychiatry are picking up now because a lot of people have got behavior problems, depression, psychological problems. So, a lot of scope. Even freelance people are very busy nowadays. You can always join a medical college or a hospital. There's so much scope for that. Blood banking, yes. Blood is a great fluid. A lot of research, a lot of improvement has occurred in the blood banks. So one can have a private blood bank, and there's so much of a need and demand for blood bank technologists in every hospital, both private and government. So job is 100% guaranteed. Criminology, a lot of problems in the society, a lot of these things. We have lot of scope both at bachelor's degree level and master degree level. We have forensic odontology, criminology, both medical, non-medical. Lot of scope in there. Every field has got a scope. Only thing is, I should have a passion. You should study very well and become a master. That should be the challenge by the candidate. Food technology, quite a long field. Nowadays, we give a lot of importance to the food nutrition. What food to be eaten when, different age group, different situations, different diseases, what food should not be eaten. So much of a technology is there. Very good field. BSc, MSc, PhDs. Do well, do your work very honestly, very humbly. Say, I belong to an ordinary middle class family. Very honest, I'm telling. I'm not a person from a very high-fi family, not a very rich family, also middle class family. Do your work very honestly, you'll get more than this. As in last week, 195 awards and achievements. Definitely you can achieve more. It's nothing great. When you do your work sincerely to your own satisfaction, it may be difficult to satisfy others. but your own satisfaction, if you can work, definitely there will be a lot of recognition, lot of achievements you can do, lot of awards. You can definitely be happy. No field is inferior, no field is superior. It's all your choice. And whatever you have selected, I always tell that it's like a good marriage. Good marriage, I repeat the word good. You enjoy that, be happy with your husband or with your wife. Don't try to pick out the small little mistakes and blow them out. No. Profession is also like a marriage. You get married to the profession. Be happy, enjoy that. Then profession will be happy, you will be happy. There's a basic concept. Never cry that you have taken a bad scores or a bad profession, right? Such things you get much more, very easy to do. Yes. If you have hobbies, never stop them. They are really going to be very useful to you because hobbies make change your attitude, change your personality, change your way of life. Any hobby, there is always a time for you to have a hobby. Yes. Hobbies like music, arts and crafts, all these are my hobbies. Yes. When I take up this, some sort of a happiness to the mind, relaxation of the mind, everything occurs, right? Even cooking is, I enjoy cooking. I eat food I cooked. So what a happiness is going to hotel and eating the junk food outside. Have your own food. So whatever you do, you enjoy. Develop a passion for everything. You can always be happy. You will have a positive attitude. People around you, your own family members, your own friends, colleagues, they will also be happy. After all, we have a very limited life of maybe 100 years or so. In that, be good, do good. That's all. So with that, again, I apologize for the delay in some technical problems. I hope I made clear. Any of the questions you have, I'd be too happy to. So try to confuse you. I hope you're not confused. So choose the best which suits you. It's like your dress, right? Don't look at others. Don't compare with anybody else. You are great. So which suits you? Discuss with your parents, with your friends. Don't compare with somebody. Every profession is great, and choose the best which you can enjoy, which you develop a passion. So I wish very best. I give my contact numbers. Anytime you feel you would like to talk to me, have a very high positive attitude. Maybe talking for 10 minutes or half an hour makes all your confusions and tensions and anxieties to be cleared, which I always do it. I hope that you will take up a great profession and study very well. Good knowledge and skill. These are the two things that you need. Have a good knowledge in your memory, good skill to implement that knowledge, and see that people are happy because of you. People are always happy because of you or your profession, right? Best wishes. Thank you for your patient listening, and I will always be available. I have two mobiles. They are with me 24 hours a day. Even in the middle of the night, you can always call me and say that I got a seat in a particular course, sir. I listen to you and I've applied the principles you told me. I'm very happy to be in this. I'll be the happiest person in addition to your family members and friends. I congratulate you. So these are my numbers. You can always call me, share your thoughts, anything you have clarification. This is exactly what I did. I like medical profession. I thought I should do something good to the people who are suffering. No regrets at all, absolutely no regrets. I was equally interested in engineering, but I still perceive, if you come to my house, you'll find a lot of instruments. I design a lot of biomedical instruments. So whatever you do, be happy. Keep others also happy. Have a positive attitude. Sarve Jano Sukhina Bhavat. Right. Be happy. Thank you very much for giving opportunity. I thank KSTA for this opportunity. There was a delay, really apologize for that. And any doubts, you can mail me, you can call me, you can send a uh, ordinary message. Both contain, the first mobile has got a WhatsApp also. You can always put up your question, comments, critical comments. I most welcome critical comments about my talk also. So if I can be of any help to even a single person who is listening to me, my life is worth it, right? Wish you all the best. Hope to see you again with good colors. You get a rank, you get a good job, good profession. Call me back and say, I got it. I will be the happiest person to congratulate you. When you come to Mysore, please do visit me, even though I'm quite busy. I'll take some time to see you and talk to you, right? Wish you all the best. Have a great day. Thank you very much.
Well, thank you very much for a very inspiring and insightful talk. You gave a very exhaustive presentation on the medical profession and that students can pursue after.
Please, sir.
Sir, to Sham Sundar sir. Hello. Hello.
Sir, ಅವ್ರಿಗೆ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ ಹೇಳಿ ಸರ್.
ಹೇಳಿ ಸರ್.
ಸರ್ ನಮಸ್ಕಾರ. talk ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು. ವೆರಿ ಇನ್ಸ್ಪೈರಿಂಗ್ ಅಂಡ್ ಇನ್ಸೈಟ್ಫುಲ್. ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ತುಂಬಾ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ನಿನ್ನೆ ನೀಟ್ ಪರೀಕ್ಷೆ ರಿಸಲ್ಟ್ ಬಂದಿದೆ. ಇಲ್ಲಿ ಜಾಯ್ನ್ ಆಗಿರೋರಲ್ಲಿ ಸಿಸ್ಕೋ ವೆಬೆಕ್ಸ್ ಅಂಡ್ ಯೂಟ್ಯೂಬ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ಸ್ ಅಲ್ಲಿ they will be highly benefited by your talk. They may choose medical as their profession and career and for higher education. In the exhaustive it will be very useful, sir. And students, we should have desire and passion to select any course.
Very much.
Some of you will select service oriented and medical profession for as your career. And sir is very generous that he has given his mobile numbers also. If you
Yes,
have
sir. You can call me. No problem. Absolutely no problem.
call, sir, or if you go to
If you
Mysore.
have any questions right now, I'll be happy to answer. If you want to think of the questions leisurely, they can always message me, email me, and WhatsApp. I'll be too happy to answer.
Sir, as of now, there are no questions.
Fine, sir. Fine, sir.
Probably they will be mailing us or messaging us. If they message, we'll be forwarding it to you for your kind.
Sure, sir. Again, I apologize you for the technical problems here.
On behalf of KSTA and all the participants present in Cisco WebEx and YouTube platform, I'm very grateful for your time and excellent presentation.
Thank you so much, sir. Thank you so much.
And I also thank participants who have joined us for this wonderful presentation. We have Abhishek. Abhishek, thank you.
Abhishek is right here, sir. He was the person who was responsible for me to be introduced to you.
Dr. Ramya is also there. Thank you. And all the participants who have joined both on Cisco WebEx and YouTube platform. Thank you very much. Afternoon.
Mrs. Abhishek, Gayatri was very helpful to me in getting all this finalized.
Thank you very much, sir.
Thank you very much, sir. Hope to meet you again, sir.
We have one more session.
Yes, sir.
All the attendees, participants, I request you to join by 3 o'clock. An expert from VTU will be talking to you on engineering. Once again, please do join by 3 o'clock. Thank you. I'm also thankful to my and Mr.
ಎಷ್ಟು 11:55 ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕಲ್ಲ 1 hour.
Thank you very much, sir.
ನಮ್ದು
Thank you, doctor. Thank you, Abhishek ji.